Hi, this is MedMinute with Dr. Tieche. And so we had a great response to last week's talk on Tesamorelin. So we had some follow-up questions. I was going to explain some more things about it, as well as some other questions. So I'm going to start with the questions about Tesamorelin. One was a question about the dosing frequency. How do we take it? Well, Tesamorelin is just like a lot of other peptides. It's usually dosed 5 out of 7 days a week. And really, why is it dosed that way? And how do you dose it that way? Well, you could take it intermittently several days, then take the other days, or you could take them all together and take a break. The reason is you're really just getting a maximum effect out of it that way. You could take it 7 days a week, but you're not going to get any additional benefit as far as serum levels. So it doesn't matter where the injections are given. They could be given IM or sub-Q. They could be your thigh, your arm. It doesn't matter. That's another big question. People think they have to give them to themselves in their stomach. It does not. It's just as long as it is in their body, it gets absorbed and it starts working. Another question we had is, can you take Tesamorelin or Samorelin with other peptides like GLPs, like semaglutide, tirzepatide, things like that? And absolutely you can, because they work by different mechanisms. One is working to stimulate the pituitary to release growth hormone. The other is working more peripherally to control appetite and help with weight loss. The Tesamorelin is also going to help with weight loss as well, because it's going to stimulate some more muscle activity and it helps lean down. So they're actually working well together. So there's no reason not to take them together. Another question was about, does it cause water weight? Do you actually retain fluid when you're taking Tesamorelin? And typically the answer is you do not. Unlike other things like maybe taking testosterone, you can retain a little bit of fluid, or nandrolone, decanate, you can as well. But Tesamorelin, there's generally not any fluid retention, because the activation of the muscle fibers is not to cause tremendous growth in them, which would cause fluid retention. It's actually to increase muscular activity, so actually they become more firm. You actually get rid of a lot of subcutaneous fat, so your muscles become much more delineated and carved out. So the answer is no. I guess there's probably a few people that could, but that is not typically something that happens. The third or fourth question is, do we have to monitor? In other words, one of the things that we look for when we're looking at growth hormone is serum IGF-1. And so that's something that mirrors growth hormone levels. It's one of the things that goes down with time. And so it's kind of which reflects aging. We're trying to push that level up, whether we're taking growth hormone and whether we're taking these growth hormone stimulating peptides like Samorelin, Tesamorelin, or CJC1295. So the question is, do we have to monitor those levels? The quick answer is not really, but you could if you wanted to see if we're making a dent in it and moving it up some, because there still is a wide range of that where we want it to be. But one of the things that really we're not doing what are called supraphysiologic doses. So what does that mean? We're doing doses where the growth hormone is just going to be in a normal range. So if it were to push it up too high, then you would see this number, because that growth factor would go up, and then you could see side effects from it. In other words, maybe elevation of blood sugar or things like that. But it's almost impossible to have that happen with those peptides, because there's a ceiling effect of how much it will release. So it does release it periodically throughout the day, and it's almost just lets a perfect amount out. To contrast it with growth hormone, yes, you can take a lot of that and have much more side effects with that. So there really isn't a need to monitor it. If you wanted to do it for your own benefit to see that it's actually working, you could do that. But most people actually see the physical effects, so they are themselves their own monitoring system for that. So those are some follow-up questions for Tesamorelin and those peptides. Remember to drop your questions down below. And this is MedMinute with Dr. Tieche. I'll see you next week.